7:34 coming up towards 7:35 in Trinidad and Tobago. We are continuing our conversations with United Nations and United Nations-based and related agencies in relation to gender-based violence. Today we are focusing on the health system's response to sexual violence and how that avenue can be improved. Joining us via our Zoom link are Keitha Kennedy, Coordinator of AIDS Prevention and Control, HIV and AIDS Coordinating Unit at the Ministry of Health. And also with us is Aurora Noguera Ramkisoon, Liaison Officer at the Sub-Regional Office for the Caribbean at the UNFPA, that's the United Nations Population Fund. Good morning to you both. Thanks very much for taking the time to be with us this morning. Ms. Kennedy, if I could invite you first of all to give us your perspective. When we talk about gender-based violence, when we talk about sexual-related violence from the Health Ministry's perspective, what would you like to tell us this morning?
Well, from a ministry perspective, our what we have is universal access. We want to ensure that all citizens, no matter their gender, can access our services in a manner that is comfortable and convenient to their needs.
And I suppose the most important element of that, when we're talking about something as intimate as gender-based violence, as sexual violence, there's an element of sensitivity that has to go with that, because given the very nature of it, it's not something that people can speak, somebody can speak openly about easily. Any type of violence for that matter, but especially sexual violence. Are you satisfied that there is a level of sensitivity training within those various elements and those individuals who are required to deal with these situations that ensure that it is not a traumatic experience for the victim?
Well, from a ministry perspective, again, when a person presents themselves as being a victim of any kind of violence or sexual assault, their first line of ministry or clinician should be a person who is trained to deal with any form of trauma. Now, the ministry has ongoing trainings for our personnel and our professionals. We also have support from our NGO groups and FBO groups who can provide that support to us as well. So we have a stable grounding in the ministry, but we also have support from NGO and outside parties.
And speaking of those relationships, let's bring in Aurora Noguera Ramkisoon into our discussion now, Liaison Officer at the Sub-Regional Office for the Caribbean of the UNFPA, the UN Population Fund. Ms. Noguera Ramkisoon, thank you very much for taking the time to be with us this morning as we continue our dialogue in relation to gender-based violence. What is your perspective? What perspective do you bring to our dialogue this morning?
Good morning, Mr. Mohammed. Thanks for having us and continuing to focus on this very important issue of gender-based violence. As we see the increase in COVID cases and the measures needed to keep people safe and to reduce transmission, we know that there have been increasing reports of gender-based violence, including sexual violence. UNFPA is the UN Sexual and Reproductive Health Agency, and we're working very closely with the Ministry of Health and other partners to strengthen the response to gender-based violence, and particularly sexual violence. We've been working with our partner sister organization, the Pan American Health Organization, to strengthen guidelines for health practitioners who are confronted with issues of sexual violence. And we are actually quite fortunate to have resources that have been made available through the European Union and the United Nations under the Spotlight Initiative to tackle this problem very quickly, rapidly, to improve the delivery of services to our people.
And because your area of concern is Caribbean-wide, are you encouraged by the work that is being done? Is it a Mount Everest that you have to climb in dealing with these challenges?
Well, this problem is not only a problem for Trinidad and Tobago. Yes, the Caribbean overall faces high levels of gender-based violence. We're second globally after sub-Sahara Africa. So it is a major problem and issue. Fortunately, as a sub-regional office, we're able to share good practices that obtain in other countries in the region who are facing similar problems, as well as protocols to strengthen our response. We're also working with a number of organizations, including the University of the West Indies, to look at issues of social norms and behaviors and practices that might fuel this type of behavior. The University of the West Indies is working closely with faith-based organizations, faith-based leaders in Trinidad and Tobago, as well as the Caribbean Male Action Network, otherwise known as CARIMAN, to also work directly with men and boys in terms of changing some of the beliefs, practices that fuel this behavior.
And getting back to Ms. Kennedy, with the Ministry of Health, and we often know that there are issues with process and procedure and bureaucracy and so on, and we often lament these things. But when it comes to dealing with these issues, if we're talking about gender-based violence, sexual violence, HIV and AIDS and all of those concerns, are you satisfied, Ms. Kennedy, that the processes are in place? Given the limited resources, given the challenges that any organization, any government would face at any time generally. But are you satisfied that the processes are working to help people through when we're talking about issues of gender-based violence and sexual violence, to be more precise?
All right. Firstly, the processes are in place, and there are challenges, and there would be gaps that we would have to fill. Now, we, with our partner at the UN, Ms. Aurora, as she was mentioning before, all the programmings and the networking that we have involved. Now, what we are currently working on is an action plan, and I'll let her go further and speak on that in terms of what happens in terms of emergencies, when a situation has presented itself in a country. Because we understand there are challenges. We understand that the ministry, a process wouldn't always play out itself in the way that it should. But even though that is the situation, we are ready to identify these challenges and work towards bringing closure. So that is why we partner with our external and internal stakeholders. So I'd let Ms. Aurora take further on this question.
So, Ms. Noguera for Ramkisoon, there's your cue to tell us about this action plan.
Okay, yes. So what we have observed, UNFPA is actually the lead UN agency responsible for addressing gender-based violence in emergencies with the various countries. COVID-19 pandemic is also an emergency. What we notice is that a number of service providers can no longer provide services the way they do. So we work closely with the stakeholders, including Office of the Prime Minister, Gender Affairs, to provide an ongoing mapping of what services exist and where there are gaps. And we develop what we call referral pathways. And we try and keep the public as well as the service providers aware of what services have been halted, what services continue. Part of this action plan and the delivery of these key services involve equipping partners with the necessary tools so they can provide services, even faced with COVID-19. So ensuring that they have proper personal protection equipment, as well as the means at which to provide remote service provision, whether it's a computer, a smartphone, because we have to continue to respect social distancing while being able to provide these key needed services. Part of the action plan also includes strengthening the delivery of the services, and I mentioned the guidelines and there will be further training provided to the healthcare providers so that the survivor receives holistic, comprehensive, essential services to address the exposure that she or he may have received through sexual assault. We're working closely with the ministry to beef up both the services and the treatment regimen that would be provided to survivors. Ms. Douglas, I don't know if you want to touch on some of what is done when someone is presented in the health facility who has been sexually assaulted and what type of services are provided.
Ms. Kennedy,
Yes, no
you can take
problem.
it away.
Yes, no problem. Okay, so when a person first presents themselves to a healthcare facility, there is procedures or a scheme that they will go, more or less go through. From an HIV and AIDS standpoint, they would administer what is called post-exposure prophylaxis. What this means, what it entails is preventing new infection or preventing the person from becoming newly infected with HIV. There will also be emergency contraceptives that will be administered, as well as testing for STIs, any STI and treatment of STIs as well. The clinician who is on duty or has treated the case may provide a preliminary report for the officers who may visit, because they would have to inform the TTPS of this situation. A preliminary report will be done and forwarded to the TTPS for prosecution. Further to that, another report may be required to be forwarded to this agency, because sometimes at the point of contact, you may not necessarily see all the things that is wrong with this patient who has presented themselves. So a follow-up report may be needed. Now, there are social workers assigned at the different RHAs who would provide counseling, that post-traumatic counseling, as well as the officers assigned to the TTPS. There is the victim support unit, that they also have their counselors there as well to give that integrated support to this individual.
And before we conclude, if I could go back to Ms. Noguera Ramkisoon for a final viewpoint. And thank you very much, ladies, for taking the time to be with us this morning. You mentioned social norms, and that is always a very touchy subject in any society, in any part of the world. When we touch on social norms, which seem to either tolerate, encourage, or permit, or turn a blind eye to issues of gender-based or sexual violence. What is your perspective on that as to whether we're making any ground in that area in our Caribbean region, Mr. Noguera Ramkisoon, as a final thought?
I think we are. It's a slow process, but yes, we are. We've been working very closely also with the Ministry of Education through the Health and Family Life Education curriculum, which is throughout the Caribbean community, throughout CARICOM. So we're trying to start from an early age in terms of changing knowledge, as well as those behaviors that might promote violence against women, against boys, against children. So we're working also with UE to strengthen the curriculum to tackle this issue of family violence from an early age, from primary school straight up to secondary school, and even for those young people out of school. So we have a multi-pronged approach to addressing this issue of social norms and behaviors, so that we could hopefully see a new generation with reduced violence, particularly sexual violence.
Aurora Noguera Ramkisoon, and before that, Keitha Kennedy of the Ministry of Health. Thank you very much indeed for taking the time to be with us this morning and offer your perspectives on this very important topic. Thank you very much once again. As we come towards 7:49 in Trinidad and Tobago, we'll hear a couple images submitted by Marsha Barrington as we head to the break. Looks like a full moon coming up. That would have been towards the weekend, last weekend, that we would have been in full moon, or the weekend before that we would have been in full moon, as she presents those images to us, and we go to the break now.